ഫീഡ്മെന്റ് ഓർഗനൈസർ എക്സാമിൻ്റെ 19/4/2023 നടന്ന ഫസ്റ്റ് 50 ക്വസ്റ്റ്യൻ ആൻസർ ഡിസ്കഷനാണ് ഇന്നത്തെ വീഡിയോയിലുള്ളത്. ദ മോസ്റ്റ് ഇമ്പോർട്ടൻറ്റ് ഇൻസ്പിറേറ്ററി മസിൽ ഓഫ് ദ റെസ്പിറേറ്ററി സിസ്റ്റം. So here the correct answer is diaphragm. Identify the bone which is part of the thoracic cage. Correct answer, sternum. Primary site of gas exchange in the lungs. Correct answer, alveoli. Most common organ affected by tuberculosis in human body. Correct answer, lungs. Membrane covering the lungs. Correct answer, pleura. Maximum number of oxygen molecules that can be carried by a hemoglobin molecule. Correct answer, 4. Volume of air inhaled or exhaled during a normal respiration is known as tidal volume. Oxygen is transported in blood bound to. Correct answer, hemoglobin. The site where oxygen is utilized in the human body is. Correct answer, cells. Oxygen is transported in the blood by. Correct answer, red blood cells. Silicosis is associated with increased risk of. Correct answer, TB, tuberculosis. Particulate size of air pollutants causing greatest harm to human health. Correct answer, particulate size less than 2.5 millimeter in diameter. Next question, all are air pollutants except. Correct answer, nitrogen. Which of the following statement is correct? Correct answer, Bagasos is an occupational lung disease. Next question, lung disease caused by sandblasting. Correct answer, silicosis. Next question, main symptom of patients with occupational lung disease. Breathlessness. Measures taken to reduce vehicular air pollution include all of the following except use of leaded petrol. Next question, rich source of protein for TB patient include all except rice. Food to be avoided by TB patient include all except milk and eggs. Most important risk factor for tuberculosis in India. Undernutrition. Undernutrition can be due to deficit in intake of all of the above. Recommended nutritional counseling for TB patient is intake of locally available nutrient-rich food. Next question, means of artificial respiration includes all of the following except inhaler therapy. Ratio of chest compression to artificial breaths in cardiopulmonary resuscitation 30:2. Steps in mouth-to-mouth breathing include all of the following except blowing breath 5 inches above the mouth of the victim. Immediate cause of death in drowning, that is aspiration of water into larynx or lungs. Resuscitation of drowning victims include all of the following except abdominal compression to remove water from stomach. Number of chest compression to be done per minute when resuscitating drowning patients always 100 to 120 per minute. Resuscitation of drowning victims include all of the following except bringing out of the victim from water by yourself when you are not a confident swimmer. Artificial respiration can be given in which location? All of the above. What is the ideal location for sputum collection? Outdoors or in a well ventilated area. Which of the following constitutes a good sample for sputum microscopy? 5 ml of mucopurulent sputum. Before the TB health visit is finished, the patient wife notes that the TB patient has started drinking alcohol heavily again, around 7 or 8 drinks a day. After years of sobriety, and ask for you to provide advice about the patient's alcohol use disorder. What should you advise? Here the correct answer is A. That is, identify triggers of his alcohol use, including peer pressure from friends and recommended strategies for minimizing contacts with these triggers. Which of the following is true of undernutrition and TB? All of the above. What is the theme of World Tuberculosis Day 2022? Invest to end TB, save lives. Which of the following statement is correct about TB? Option D is correct. 1, 2, 3, and 4. That is, all the options are correct. Next question. What are the features of people suffering from latent tuberculosis infection? Have no symptoms. World Health Organization recommended a control strategy for TB known as DOTS. At which place the cause for the disease tuberculosis was announced? The Institute of Physiology, Berlin. Which of the following statement is or are correct? All the options are correct. 1, 2, 3, and 4. Option D is correct. Next question. Name the causal organism that is responsible for causing TB. That is bacteria. World Tuberculosis Day. Option A, 24 March. National Tuberculosis Institute. Located Bangalore. Yesterday discussed. A patient taking isoniazid should be monitored for what deficiency? Vitamin B6. A patient with active tuberculosis is taking ethambutol as the health visitor. You make it priority to assess the patient's vision. Ethambutol, always check vision. You note your patient's sweat and urine is orange. You reassure the patient and educate him that which medication below is causing this finding. Rifampicin. Your patient who is receiving pyrazinamide reports stiffness and extreme pain in the right big toe. This site is extremely red, swollen, and warm. You notify the physician and ask the health visitor. You anticipated the doctor will order. Correct answer, uric acid level. Should check always patient on pyrazinamide. As the TB health visitor, you know that one of the reasons for an increase in multi-drug resistant tuberculosis is all the above. That is incorrect medication ordered, immigration of patients from areas of the world where drug resistant TB is common, non-compliance due to duration of medication treatment needed. You are teaching a group of long-term care health givers about the signs and symptoms of tuberculosis. What signs and symptoms will you not include your education? Weight gain. Which non-communicable disease is strongly associated with TB? That is diabetes mellitus. Diabetes mellitus ഉള്ള ആൾക്കാർക്ക് കണ്ടിന്യൂസ് കഫ് ഉണ്ടെങ്കിൽ നമ്മൾ എന്ത് ചെയ്യണം? TB സ്പ്യൂട്ടം മൈക്രോസ്കോപ്പി ചെക്ക് ചെയ്യണം. So this is the first part of question answer discussion. Hope you understood all these 50 questions. Thank you for watching. Please share this video.